I had another great residency session this past week, continuing the discussion around the value of PT and getting into thoracic spine treatment. And we found a great bridge between those because when we look at the thoracic research, it largely focuses on thoracic manipulation. Now, when we look at that research, yes, there may be some efficacy in that for a short-term reduction in pain or disability, but if our treatments focus so much on short-term outcomes and we ignore the treatments that may not lead to that, for example, pain neuroscience education, a lot of detractors of that will say the effect sizes are terrible. It doesn't work. It depends what you're looking at. P&E, for example, works well for reducing future healthcare utilization. That's what I care a lot more about with my patients. And so there's a danger in having such a big emphasis on treatments that are short-term, reducing pain, really creating a mindset of, I will fix you. I'm going to, as the therapist, make this better. Or if we have a big emphasis in the treatment, constantly talking about what's your pain level now? How about now? Okay, we fixed this. What has it gotten to? We're going to change this movement. Now you squat with a little bit different of an angle at your back or your hips. Now how does it feel? What's the long-term carryover? What relationship are we teaching someone with pain? Are we teaching them that pain needs to be avoided at all costs and fixed? Because if we do that, if we're not teaching individuals that pain is a part of life, acute pain is normal, and can we address that, address people's fears, concerns, anxiety around pain, if we don't address those and we give a fixed mindset, then if someone does finish physical therapy, and then they do experience pain again, whether it be a few days, a few weeks, a few months later, what's their mindset going to be? Is it going to be, hey, I was warned about this, this happens, this is part of life, I'm going to continue to move, I'm going to be active, I'm okay? Or is the mindset going to be, great, I guess PT didn't really work. It didn't fix me. It helped in the short term, but now I need to go find something else that might truly fix the problem. And so I'm not saying that there's no value at all in short-term treatments and manual therapy, but that shouldn't be the primary focus. And we shouldn't be saying that other treatments don't have value because they don't have that short-term efficacy, the short-term reduction in pain or changes in disability. There's a lot more to treatment of our patients. I appreciate you joining in. Look forward to talking next week.